It's important that all mothers understand how to hand express for their babies. Sometimes mothers may feel a little bit full or engorged and so may want to express a little bit off before a feed. Or somebody else might want to feed the baby so they can express into another container to feed the baby by somebody else. Baby might be removed for some reason at birth, might be sick, so it's important that mothers know how to hand express for their baby in that instance as well. It's important that mothers are comfortable when they're hand expressing, so as to find a nice comfortable place where they can sit for a little while to hand express. It's important that they've got a container to collect the milk into, so a wide plastic bowl that can be sterilised if they want to keep the milk. So first of all, what she needs to do is feel her own breast, massage the area under the skin to see if she can find a change in texture. That change in texture is often found a centimetre or two behind the nipple area, around about where the areola finishes, although that can change from woman to woman. Once she's found that change in texture, she needs to place her fingers in a C-shaped hold with the thumb and the forefinger at the top and the bottom. And then she needs to build up a rhythm of pressing in towards the breastbone and releasing until she finds that the breast milk starts to come. She can also try and stimulate her nipple to try and promote the release of the oxytocin, which helps the milk flow. It's important not to slide your fingers along the skin towards the nipple, as this can make you sore. And it's important not to squeeze the nipple, as again this can make women sore as well. It may drip or come quite slowly to begin with, and it's a skill that is learnt through practice, so don't be alarmed if you don't get much off straight away. The milk supply may get faster and you may find it spurting into the bowl, and once that slows down to a drip again, you can rotate your fingers around the breast so you clear every single part of the breast. Once one breast starts to diminish, then you can change over onto the other side and collect more if that's what you want to do. Hand expression is particularly effective when women feel engorged, and it's very useful to express a little bit off for the baby, so to help with positioning and attaching the baby to the breast. It's also useful for women who are suffering from mastitis or blocked milk ducts, as it can relieve the discomfort and it can help the milk flow and clear the blockage.
So with your knuckles, just very gently, whatever you're comfortable with, yep, that's fine.
Massaging your breast gently, especially around the nipple and dark area called the areola, stimulates the release of a hormone called oxytocin, which triggers the release of milk. This is known as the letdown reflex. Some women feel a tingling or squeezing sensation, but others don't feel it at all.
How long would you do that for?
You want to massage for a few minutes, particularly around the nipple and the areola. Once you've done that, then what you want to do is find a change in texture in your breast, okay? And the easiest way to do that is just to gently walk 2 fingers down your breast, pop your fingers on, okay, and just gently walk them down and see if you can feel a change in the texture. Right? Yeah, that's it. Sometimes women find where the areola, the darker skin, meets the lighter skin, okay? And where you feel that change in texture, you want to then make a C shape with your fingers like that, okay? And then rhythmically just compress and release, okay? I'm going to give you that to hold with your other, because you might find you get some milk. So compress and release. That's it. Compress and release. So if you do it with both, yep, that's you. Okay, well. Right, and that's because you've got lots of ducts, so you can't always tell where the milk's going to go. So try and do, what you're doing at the moment is when you're coming down, you're coming forward slightly, which you want to try and avoid, because you tend to, then what you're doing is pulling at the skin. So you want to try and just do straight up and down. That's it. And the other important thing as well is you've got lobes all around your breast, okay? So when you're compressing and releasing, you want to also move your fingers round so that you can get all the lobes in the breast and get the milk from all the lobes, okay?
It's important not to slide your fingers down your breast, squeeze tightly, or pull your breast or nipple. All that's needed is gentle compression. Incubator. Although your neonatal unit may have a dedicated expressing room, being near your baby can stimulate the hormones that trigger the release of breast milk.
That's great. And you do find that that's why it's really good to sit by the baby's cot as well, because it helps with your letdown reflex as well. So it's really good. You're getting loads.
it just doesn't look much, but I think it's gold.
Absolutely, no, it is. Absolutely, it's gold dust. It's really important, yeah.
What may seem a small amount is all a newborn baby needs. Stacey has expressed a few millilitres of milk. You can expect to express even less in the first few days after your baby is born.